Good afternoon, everyone. Hope you're doing well. Um, I hope that this week has gone well for you, and I am hoping that you'll really enjoy what we have to offer today. Last time, we talked about colon cancer screening, but this time around, I felt just an urgency to revisit breast cancer screening. Um, so, let me tell you who I am. I am Dr. Hope Watts, board certified family physician, health coach, speaker, and lifestyle expert. I inspire mid career women to bring about lifestyle transformation. I do this by finding the correct foods and fitness levels for them so they can have the energy they've always wanted and live their best lives. So, let me go back and explain why I feel I need to do breast cancer screening. I I had some thoughts about what happened with the colon cancer screening because I went back and did some more looking at some more research and realizing that there are some um, reasons why people don't get their breast cancer screenings. And I wanted to make sure that during this COVID season, that everyone is going to get their breast cancer screenings. And many are thinking, I don't want to go to the hospital because, there's a lot of COVID patients there, and I don't know what's going to happen when I get to the hospital. So let me just, put this in your mind that many places have made accommodations for patients who are there just for screening. Um, and some screenings don't have to be taken place at the hospital. Sometimes you can go to an imaging center, which is affiliated with the hospital, and get your screening done there. And that's what I elected to do this time. At the imaging center, they're not booking as many people, so you can really get in and get out. And sometimes they have you go through another door so that you're not, while you're going out, you're not having patients come in that could, you couldn't be socially distanced. So I would encourage you to make sure you're getting your screenings and so that you don't have a year that's missing because of COVID-19. So some of this may be a review for some, and it may just be more information that maybe you had not thought about before or had ever known about. So breast cancer screening refers to getting a mammogram every year and being seen by your healthcare professional, usually your doctor, and getting a breast exam. And this is done to detect breast cancer before symptoms develop. And we'll talk about the symptoms a little bit later. Also, to find breast cancer at the earliest stages, because the history has been the earlier we find breast cancer, the better we can optimize the outcomes and have more breast cancer survivors. The research shows that when people have regular annual mammogram screenings with no symptoms, that we have lowered the number of women who die from this disease. And that's our goal anyway. And we've decreased this by 30%. And I think you know that breast cancer screening has really ramped up in the last 10 years. There are many breast centers, and you don't even have to go to your doctor to get a prescription or an order for it. If they know that you've had a mammogram before, they'll send you out the card, or you can just call them and say, I need a mammogram, a routine mammogram, and they'll just put you in the schedule. So it's made it easier for people to get their mammograms and keep up with it. So I am encouraging you again to get your mammogram during this COVID season. Now, the guidelines for people who are healthy are as follows. 25, and really I'm saying 20 to 40, women should be engaging in breast self-exam. I know that there are times when I go to get my mammograms, they will actually ask you if you have done your breast self-exam, and you have to sign off on it. So they're still encouraging that. I know there was some other research in other countries about breast self-exams and whether they were accurate enough or whether they really made sense to do. But in this country, we're still recommending breast self-exams. So ages 20 to 40, we are recommending breast self-exams and a yearly exam with your doctor, breast exam with your doctor. Ages 40 and older, you should still do your breast self-exams and get a mammogram. Now, from what I've seen, this varies in different places. If you're going to a breast center, the 40 starting age is probably recommended. But in some other centers that are more like cancer centers, I know sometimes they would recommend earlier times, but you would have to talk with your doctor about that. Because getting mammograms earlier than the recommended time frames creates a problem with your insurance, and it may not be covered. So you don't want that to happen. So we just want to remind you again that breast self-exams are still recommended to help with knowing what your breast feels like. If you're having pain, you'll know what side it's on if it's been there before. Also, there is a newer mammogram out. It's not newer, but it's been gaining popularity in the last few years, and that's called a mammogram with tomosynthesis. That's just a fancy name, and it just means it's a 3D mammogram. So instead of front and back, they can get a whole visual perspective of the whole breast, and that helps them when they're diagnosing breast lesions, breast problems. Now, there are some certain groups that may need more aggressive screenings, and you may not be in those groups, but just to give you some more information, persons who have a history of breast cancer tend to need to be followed very closely. And within the first 5-6 years, they're usually seen by an oncologist, and they recommend a breast exam, mammogram, every year. If they feel they need other studies like MRIs or so, they will more than likely let you know if you fall into that category. Family history of breast cancer. Now, every family member does not increase your risk of breast cancer. If you've had a mother with breast cancer, a daughter or a sister with breast cancer, those are the ones that increase your risk. So if that is the case, and they got their breast cancer before age 50, you should get your first mammogram 10 years before that person was diagnosed with breast cancer. So for example, if they were diagnosed with breast cancer at 46, then you should get your first mammogram at 36. So it's going to be earlier than the 40, but they don't recommend anything earlier than age 25. Now, there are certain women who have genetic predisposition for breast cancer. And the most common genes that we talk about are BRCA1 and BRCA2. These genes are found in certain high-risk groups, certain European groups, but don't quote me on that. But usually these persons know about it, or there are certain groups that they will test for this. And usually there's a lot of genetic counseling that goes on with this, and they will check for those genes and other genes, and then determine when you will need your mammogram. The reason being is there's been some popularity, people on Facebook or wherever, to say that They want to take all their breasts, they want to take their breasts off rather than going through the agony and the worry of having the breast, having the diagnosis of breast cancer and then having them taken off anyway. So it's not that frequent, but just to let you know that there are those types of things that can happen. Early radiation exposure is another high risk group. And this is what they call mantle radiation. People with Hodgkin's lymphoma, they may have lymph nodes that are cancerous in their neck and around in their shoulder, and they put a mantle when they're doing the radiation. It's kind of almost like a little cloak from the neck all the way down past the breast. And many patients who've had this treatment are at high risk for breast cancer, and they will probably get their mammograms earlier, probably age 35 or so. So we've just talked about screening for right now. And I want to just talk about the symptoms of breast cancer. We don't want people to have those symptoms. We want them to come to medical attention before this happens. But as we stated in our talk on colon cancer, there's a lot of fear associated with any kind of cancer. And people get frozen with fear and anxiety, and they cannot get this forward movement to go in and get the screenings that they need. So lumps. Lumps are probably the most frequent sign that you would see. Lumps in the breast or either breast or under the arm. Sometimes you can have swelling in the breast. Now, does the swelling in the breast mean you definitely have cancer? No, because there are other conditions you can have and have swelling in the breast. You can have dimpling in the breast. If you have little, the breast doesn't smooth out like it should, you know that you need to come to medical attention for that. Any kind of pain around the nipple should make you alert that you do need to see the doctor. Change in size of your breast. If one breast is larger than the other and it's never been that way before, you do need to come to medical attention. Pain in any area of your breast. Now, these symptoms do not necessarily mean that you have breast cancer, but these are warning signs that you do need to come to medical attention. And one of the other reasons is that you may be getting your breast screening like you should, but you may have a friend who, you just happen to say, oh, I was at the imaging center and I have a clean bill of health. I don't have anything wrong. And they're not saying anything. And so you ask them, have you had your breast cancer screening this year? And they may not have anything to say to you, or they try to change the subject. So we want you to have this information also so that you can be an advocate for them. And it may not be a friend. It may be someone in your family. I happen to be talking with my uncle, and he was talking about problems with his stomach and things like that. And we got to this conversation, and I said, well, you have had your colon cancer screening, right? He says, no, I've never had colon cancer screening. So my uncle's older, so I was thinking, let me just talk about something else and see what he says. So we talked some more about it, and then I came around again. I said, well, they'll find that out with your last colon cancer screening. He says he hasn't had one. So I'm in a predicament about how to get him to the colon cancer screening because he's had prostate cancer before. So I'm not sure what's going on. Nobody knows now. So it's to get you to advocate for other people in your family and ask them. And I think because in certain populations, we do not discuss medical conditions, we are silent and we don't know if there are other hereditary conditions. So I think that this talk was not just for the persons who are listening to it now, but to advocate for other people in your family or in your friends. So what I would like to do today is do something a little different. I want to ask some questions about cancer, breast cancer screening, to see if you've been listening or you know ahead of time. So one of the questions is, women who are healthy and are not at high risk for breast cancer, when should their mammograms start? Should they start at age 50, age 55, age 40, or age 45? So I'll ask that question again. Women with average risk or they're healthy should get their first mammograms at what age? Age 50, age 55, age 40, or age 45? So the correct answer is age 40. They should get their first mammograms at age 40. Okay. What is the best time of the month to do your breast self-exam? Now, there's always controversy about whether you should do it now or later, but let's see if we can pinpoint when the best time is. Right before your period is about to start. At the start of your period. So we have right before your period, so like 4 or 5 days before your period, or at the start of your period, mid-cycle, or it's not advisable to do breast exams at all. So let's go over them again. Right before your period, 3 to 4 days before your period starts. Mid-cycle, that means some people get some little pain on the side, a little twinge there, or at the start of your period, or it's not advisable to do breast exams anyway. So the answer is mid-cycle, because at that point, the hormones aren't creating situations where you're having a lot of lumpiness to your breasts, and you're going to be better able to determine if you have lumps or not. So this is a little easier. True or false? You can tell if you have dense breasts by the look and the feel. I'll repeat that again. You can tell you have dense breasts by their look and feel. So the correct answer to that one is false. Density of the breast has no association with how they look or feel, because you can have very lumpy breasts and they don't have to be dense breasts. So if anyone says, oh, my breasts are dense, and I know it because of this, you know that they're not telling the whole story there, or they don't know for sure. Okay, another true-false question. Most of the time, an abnormality on the breast is not cancer. True or false? Most of the time, an abnormality on the mammogram is not cancer. So the answer is true. Sometimes you can have benign cysts or just scattered calcifications, and that's just a term they have, the radiologist term they have. And the calcifications couldn't mean, sometimes they do have a meaning, sometimes they don't. And if there are some abnormalities and the radiologist feels there needs to be follow-up, only 20% of the abnormalities go on to get a biopsy. And a large percentage of people who have abnormalities, or there was some question about their mammogram, they don't have cancer. So that can be reassuring in some ways. True or false? I'll give you one more question. True or false? The size of the breast lump determines how dangerous it is. True or false? The size of a breast lump determines how dangerous it is. The answer is false. You can have a tiny tumor that is very aggressive, or a very large tumor that shows no aggressiveness or very low aggressiveness at all. It just depends on what the biopsy shows, what kind of tissue it is, how, and when the pathologist looks at it, he determines based on history, or based not on your history, but what he has seen before, whether it is really an aggressive type tumor. So make sure you discuss that with your radiologist who's doing your tumor or doing your mammogram. So one last question. Is it better to get a mammogram without 3D, or is it better to get a mammogram with 3D? Now, 3D is tomosynthesis. And 3D means, you're not getting the front and back, you're getting, sides, and you can turn it around and get a better view of the whole breast. So the answer is yes. It is better to get a mammogram with 3D or tomosynthesis. This is because they have found that you can get a better mammogram result and you don't have to come back to have, an ultrasound or a repeat mammogram, because the 3D with tomosynthesis, or 3D equals tomosynthesis, you'll have a much better outcome because they have a better view of your breast. So I'm just going to talk about a few things you can do to decrease your risk for breast cancer. And what I'm finding is that some of the things that we talked about before for a healthy lifestyle, such as exercise, diet, and other habits, are just revisited with the colon cancer, as we talked about last week, and with breast cancer. Number one, stop smoking. And everyone knows that smoking of any kind, we did delineate all the different kinds. That's vaping, cigars, and cigarettes. None of them should be used because you're putting toxins into your body that can set the stage for cells to become abnormal. Limit the alcohol. Some places that I observed said one drink a day, and then they said how many ounces or everything. Others have said once a week or less, because alcohol is associated with breast cancer. Lose weight. We had talked about weight loss earlier on, and that's how we talked about diets and exercise. Being obese or overweight is a risk factor for breast cancer. Getting the right exercise. We spent a whole session at least 4 or 5 weeks ago about exercising and how much exercise and what type. The exercise that they're recommending is cardiovascular exercising, brisk walking, jogging, swimming, bike riding, elliptical, Peloton, if that's the one you like. And they're recommending 150 minutes a week of moderate exercise, brisk walking, for example, or 75 minutes of highly vigorous exercise. Breastfeeding. Breastfeeding is probably one of the very good ones to decrease breast cancer. In this country, we've kind of made a shift. At first it was, all formula, but now we have certain groups that are there to help moms when they want to breastfeed, or they're having problems breastfeeding, because it is very protective and it does decrease breast cancer. The other things are that you need to consider is hormonal therapy during menopause. There has been a shift in the last 10 years about not using hormonal therapy as aggressively as we had in the past. But I know there are times when people do need to have something. And really, if you and your doctor have discussed that, after the first year, they should reevaluate you to see if you still need to be on that, and discuss other alternatives, because there are other alternatives to hormonal therapy. And let's get back to a healthy diet. About 5 weeks back, we talked about all the different kinds of, well, not all of them, but some of the better ones, or ones you'll hear about. But a healthy diet, like the Mediterranean diet, is recommended. And it is recommended by a lot of physicians, and especially cardiologists, because it emphasizes a lot of fruits and vegetables, whole grains, legumes, or beans, and it de-emphasizes red meat in favor of fish. And so there you have it. So I would like to thank you for coming today. And I am Dr. Hope Watts, board certified family physician, health coach, speaker, and lifestyle manager. And as I stated before, I inspire women, mid-career women, to get to have transformation in their lives. And we do it by finding the right foods and fitnesses for them so that they can have the energy they need and live their best lives. Please follow me on Facebook, Twitter, and Instagram. Thank you.